But I think what ends up happening in the mold world is people focus so heavily on the mycotoxins, just because, again, they're known to cause all sorts of really bad health issues, that people really skirt over mold allergy. And I
Right.
don't think most people appreciate how much mold allergy impacts a child's brain or an adult's brain. I have some people in my practice, when it's a damp, rainy, humid day, they are suicidal. It has
Yeah.
that effect on their brain. It can cause cognitive impairment. It can cause mood changes. It can cause sleep issues.
Welcome to Demystifying PANS and PANDAS, the podcast where we uncover the mysteries, breakthroughs, and hope behind these life-altering conditions. I'm Dr. Nancy O'Hara, a board-certified pediatrician, educator, and advocate with over 3 decades of experience helping children and families navigate the challenges of neurodevelopmental and neuropsychiatric conditions, especially PANS and PANDAS. These disorders can feel overwhelming, but here we'll break down the science, explore transformative treatments, and share stories of resilience and recovery. If you've ever wondered what's possible for your child or how to find answers, this is the place to start. Let's dive in. Hey everybody, Dr. Nancy O'Hara again, and I am thrilled to welcome Dr. Darin Ingels. Darin is just a wealth of information, not just because he's an amazing naturopath, but he formerly had tick-borne disease. He was formerly a biomedical technology engineer. He's lectured. He's the author of the Lyme solution. He's done so many podcast summits, and I'm just thrilled to have him here. So, Darin, thanks so much for joining me.
Oh, my absolute pleasure, Nancy.
Well, thank you. Can you just tell everybody a little bit more about yourself and how you got to where you are today?
Gosh, how much time do we have?
I know. Don't take the whole hour, but give us a little brief synopsis.
Well, I actually started my career as a clinical microbiologist, and I worked at a large teaching hospital outside of Chicago and worked in microbiology for 5 years before going to naturopathic medical school. I went to Bastyr University outside of Seattle and did a residency there, and then ended up in your neck of the woods in Connecticut. And I had a practice there for 18 years and then decided to sell that practice and move out to California. So I've been out here full time since 2018. So I've been in practice now for almost 26 years. My background actually is in environmental medicine, where we look at all the different environmental factors that influence health. But, I was a Lyme patient in 2002. I got bit by a tick. Of course, we live about 30 minutes from Lyme, Connecticut. And I had classic Lyme disease, bullseye rash, headache, fever, joint pain, the whole gamut. And the long and short of it is it took me about 3 years to get my health back. So, I started really applying to what I was doing for myself to my patients and found that they started to get better faster. Ultimately, wrote a book called The Lyme Solution. And again, it still comprises a big part of my practice today.
Yeah. Well, good old Northeast for giving you Lyme disease, but as we know, it's everywhere these
Yeah,
days,
exactly.
throughout the world. So, and you and I both treat children and adults with PANS and PANDAS. And you have taught me so much about the use of botanicals and herbs in the treatment of these kids. Can you talk a little bit about your use of herbs, why you use them, the benefits, why they're useful in the treatment of PANS PANDAS?
Absolutely. And I should preface that question just that, again, when I had Lyme, again, I did the conventional thing. I went on antibiotics. I was on antibiotics for 9 months, oral antibiotics.
Wow.
And after 9 months, I just kept getting worse and worse. I think I'd lost about 30 pounds in that time because my gut was a mess. I was nauseous all the time. I just wasn't eating very well and couldn't eat much. And I met an herbalist in New York City. He's actually a Chinese medical doctor, Dr. Zhang. And when he
Yeah.
started treating me with Chinese herbs, within a month, I felt 80, 85% better. So, it was kind of interesting, being a naturopathic doctor. I mean, herbs are kind of in our wheelhouse, and why I didn't start that way, but I was still new in practice, you know what you know. And,
Yeah.
but it was my wake up call that, herbs are incredibly powerful. And I think the cool thing about herbs is that, they're plants. And so I think of plants as like food. The way your body utilizes and assimilates herbs is very similar to how we utilize and assimilate food, which means that a lot of these herbs get absorbed in the very first part of your small intestine. Very little makes its way all the way down to your large intestine, where a lot of your gut bugs live. So we always worry about antibiotics disrupting our normal microbiome. And plants, by and large, rarely do that. Plus,
Yeah.
if you look chemically, the more we study plants, we realize that they are chemically complex. And it makes a lot of sense. Like if I'm a weed that grows out in the middle of the savanna, I have to have my own innate chemicals to protect myself from predators, from insects, for things that want to destroy me. So those things that are built into the plant to protect the plant in many ways help us as humans.
Yeah.
And you look at the chemical breakdown of any one plant, there might be 8, 12, 14, 16, 20 different things that's in it that have biological activity. So we can utilize that to our advantage where we can really mix and match different herbs, different plants to tailor it to the individual. So for someone who needs more anti-inflammatory effects, we've got plants that have good anti-inflammatory effects. Or we need to boost the immune system. Well, we have plants to do that. We need to improve circulation. Well, we have plants to do that. And in reality, what we find is that a lot of these plants kind of do a lot of that. So there may be
Right.
one plant like, cat's claw. Cat's claw is effective at killing Lyme. It's also a great anti-inflammatory. It also helps with circulation. So, I like the ability of being able to really have true personalized medicine with our kids dealing with PANS. And, kind of coming back to, I guess, your original question about how does this apply to PANS? Well, we've got this neural inflammation being triggered often by a critter of some sort. So again, we can find the herbs that target that bug if we know what it is. And honestly, even if we don't know what it is, it's okay. Herbs are a bit more forgiving than antibiotics because with antibiotics, you have to know exactly what you're treating. Because if you pick the wrong antibiotic, it just doesn't work. But with herbs, because there's so much overlap and the different types of microbes they can affect, again, even if we don't know for sure what that organism might be, there's a good chance we're going to cover it when we start mixing herbs in combination. And again, a lot of these herbs are anti-inflammatory, so we have a way of calming neural inflammation. We have a way of targeting organism. And then depending on how it's manifesting for each child, whether it's more anxiety, more OCD, if it's tics, again, we've got specific botanicals that might be more symptom specific to help cover that. I think we're always looking at root cause medicine. So I hate to say we give stuff to cover the symptoms, but in reality, there are times where a child's ticking so bad, it's disruptive to their life. And
Right.
would I rather use an herb or would I rather use a steroid? Well, if I can get away with an herb, I'd rather use that than something like steroids.
Absolutely. And there's so much to unpack with what you said. I mean, number one, I think why I use herbs is because, like you said, do a lot less harm than antibiotics. But more importantly, when we talk about a need for a multi-system approach, herbally, we can get that. And like you said, sometimes often we don't know what the trigger or triggers are. And when there's more than one, and when it's not just a bacteria, when it's a virus or yeast or mold, using herbs can be much more fruitful than using an antibiotic. I always get so irritated is too strong a word, but disappointed when I see, in some of the listservs, well, I put him on the antibiotic and he didn't get better, so it must not be PANS. No, you probably just didn't put him on the right intervention. So I think all of those factors come into play when you talk about the use of herbals and botanicals.
I was at a NutriMedics conference years ago with Dr. Lee Cowden. Many of you probably know who Dr. Cowden
Yeah.
is. And, he's a Texan and he's talking about these herbs and he's like, well, you talk about that herb, that's a keep herb. That's a keep herb. And I kept thinking, a keep herb? I'm like, I have no idea what he's talking about. You keep it in the closet, you keep it in the kitchen. I said, well, I don't understand. What's a keep herb? He goes, well, it kills everything except people.
Yep.
And I like that because he's right. Because a lot of these herbs, again, they're antibacterial, they're antiviral, they're antifungal, they're antiparasitic. So, when you give an antibiotic, often you have to give an antifungal because the antibiotic is going to dispose to a yeast infection. I never see that when we use plants because, again, we're keeping, I think, the balance of the terrain much better off, even though we can still target. And, for the life of me, I guess I don't fully understand how we can be so effective at targeting Lyme and Bartonella and Babesia and Anaplasma and all these things and not have this major disruption to our normal microbiome. It seems
Yeah.
to me you can't kill the bad stuff without killing at least some of the good stuff. But I think that's the beauty of nature. There's a wisdom to these plants that for whatever reason, they seem to spare the things that we really need and kind of hone in on the things that might be overgrowing or starting to take over in a negative way.
Right, right. And antibiotics are just killing. We need a lot more than killing. If they do that, I mean, we need the support to our immune system, and so many of these herbs are immune modulating, anti-inflammatory. Is it why are herbs a better option than steroids, than IVIG, from your perspective?
Well, certainly from a safety standpoint, we're much safer. From a practical standpoint, I mean, I know how it is in our both of our practices, trying to get kids hooked up for IVIG, even if you can get insurance to improve it, for getting a child to sit still for a long infusion with a needle in their arm or a catheter, can be really challenging. And a lot of these kids just won't tolerate it. They'll rip that thing out as soon as it goes in. So we've got a practical approach that's not always possible. Certainly from a cost standpoint, herbs are relatively inexpensive relative to something like IVIG. And, from an effective standpoint, the steroids are a short-term solution. When the kid's in a crisis, if they need steroids, absolutely. If they're harming themselves, harming others,
Right,
they're a danger, or they're a risk, you got to do what you got to do to put out the fire. So
right.
whether it's
Eating disorders that are severe, et cetera.
exactly. So whether it's
Yeah.
ibuprofen, steroids, you got to do what you can to make that situation, more tenable. But, something like IVIG, I have had some kids that honestly have done pretty well. I've had more kids where it has not worked, or it's only worked while they were on it. And then once they came off the IVIG, they regressed fairly quickly thereafter. So in my mind, the story I tell myself is, if I'm not really fixing the problem, is that really for the best benefit of the patient? I
Hmm.
mean, again, there are times we have to put on the Band-Aid, but ultimately that is a stopgap to get us to our goal of fixing the problem permanently so that
Yeah.
we don't have to keep relying on the supplements or the medication to keep them in a healthy state. And, I think for IVIG, I also worry that it's a blood product. And as much as we screen blood products for infectious disease, you know, things can
New ones pop
do
up all the time.
things can slip through, and I worry a little bit, since COVID and COVID vaccines and spike protein getting into the blood supply. I haven't seen any data on that, so I don't know what the status of that is. But we know that spike protein can be very provocative for a lot of people, and I would hate to introduce something into the system that's already very sensitive and inflamed. We don't want to throw gas on the fire. So, I just think there's a lot of concerns around IVIG. But again, I've had some kids where we've kind of exhausted our resources of other natural therapies. They haven't responded the way we want. Fine. When I think about medicine as a whole, I think, the difference in your training and my training when we were in medical school, you probably learned a lot about drugs and surgery. And although we learned about that too, it's not the first step. It's usually the last resort. So
Right.
what else can we do on that hierarchy that might be safer, more cost effective, more natural? And then we kind of work up. So I'm not opposed to antibiotics. I'm not opposed to IVIG. It's just not the place I'd start.
Right. And so when you start, what are some of the herbs that you consider? And obviously it'll matter whether we're talking about a tick-borne disease or strep or virus, but what are some of your go-to herbs that you particularly like in the kids with PANS pandas? I'd like to thank NutriMedics for sponsoring this podcast. NutriMedics is a company specializing in high-quality herbs, botanicals, and nutraceuticals. They have formulated research-based tinctures critical in the care of children with tick-borne diseases such as Borrelia, Bartonella, and Babesia. But also important is that they are a company with integrity, with charitable purpose, and with a goal of helping clinicians care for the families in their practice. If you do not yet know about their practitioner support programs, their lunch and learns, check out more at nutrimedics.com. And thank you.
I mean, cat's claw is one of my favorites. I just find consistently cat's claw, because of its antimicrobial and anti-inflammatory effects. And again, when you look at the research, cat's claw is a immune modulator. It does regulate T cells, Treg cells. So that's almost always in the mix. I think Chinese skullcap is incredibly helpful. Again, it's a good antimicrobial. It's one of the herbs they studied at Johns Hopkins University that's effective against Bartonella, Lyme, Babesia, which means it's also probably good against a lot of other microbes out there. And again, also a very good anti-inflammatory. I use a lot of banderol. Banderol and Kumanda are both made from Nutramedics, and they both come from the bark of a tree that grows down in the Amazon jungle. Again, very broad antimicrobial effects, but also very good anti-inflammatories. I think Artemisia is one of my favorite herbs as well.
Yeah.
Artemisia, it's a weed that grows all over the world, and there's different strains of Artemisia. They've been using Artemisia to treat malaria for decades.
Yeah.
So very effective against babesia. But again, they also use Artemisia to treat rheumatoid arthritis. Why? Well, because it helps modulate the immune system and downregulates inflammation. So, the interesting thing with herbs is that, again, even if we don't know what the microbe is, and even if we're not sure that microbe is even the trigger, there's so many other benefits of the herbs because of what
Right.
they're doing to modulate the immune system and control inflammation. Even if the focus isn't really, I need a bug to target, we're still going to get a lot of these benefits. So I have a lot of kids where, we go through the litany of testing for tick-borne illness, we're testing for strep, we're testing for different viral etiologies, and everything kind of comes back negative, but they're still very symptomatic. I'm like, my conversation is like, hey, we can still use these plants in a very effective way. If there is something in the background lurking that we don't know about, great, we might cover that. But because they're anti-inflammatory, because they help with circulation, because they do all these other things, there are still benefits. And with kids, I'm always amazed, and I guess at this point I shouldn't be, how drop doses of these herbs can be clinically effective.
Yeah.
I have some kids and adults that do 1 drop a day, 1 drop twice a day, how 1 to just a few drops a day can make a difference. And on paper, it almost kind of sounds like it shouldn't, but it does.
Right.
And
Right.
so, I've had this argument with, mostly medical doctors over the years who are very convinced that if you're not using antibiotics, you're not really treating, and that herbs aren't nearly as strong. I'm like, well, come spend a day in my clinic, and I think you'll feel different because we see it all the time that people will start herxing at very small doses of these plants.
Yeah.
So, sometimes a little goes a long way.
Yeah, and we now have research studies behind us that show that herbs, one you didn't mention, Cryptolepis, is
Yeah.
one that's shown very good, not just against Babesia, but against Borrelia and others. So yeah, I love all the ones you mentioned. And the other thing is the amount of time.
Yeah.
We both agree that the doxycycline for 1 day or 2 weeks is ridiculous. And the length of time in that is needed to treat these tick-borne illnesses, especially, it makes much more sense to use herbs for that reason, also.
Well, and if you think about drugs like doxycycline and azithromycin, again, I don't think most people understand that these drugs don't actually kill the bug.
Right.
They're what they're called bacteriostatic. They're not bactericidal. So what that means is they stop the bacteria from replicating. So whatever's there, it kind of holds it at bay, but it's still dependent on your immune system's ability to eradicate it. So if you have any element of immune dysfunction, your body isn't handling it the way it should, it's not really getting rid of it. So we know that it only, like, we'll just use Lyme as our example again. We know that doxycycline works when it's in its log phase. That means when it's replicating, when it's growing, it stops it from doing that. But when it's dormant, when it's not replicating, it doesn't do anything. Well,
Right.
we know that a lot of these herbs will kill Lyme, whether it's replicating or not. It has bactericidal effect. I mean, that's completely different. So I will argue, and we have some evidence. Dr. Eva Shoppy at University of New Haven, at least in vitro, when she compared Cemento, Banderol Commanda to doxycycline and rifampin, found that they were more effective because, again, they kill the bug no matter what stage it's in.
Right, right. And I heard you recently talking about tuberculosis,
Yeah.
which replicates every 20 hours as opposed to Borrelia, which is replicating what, 1 to every 16 days.
Yeah.
And we'll treat somebody for TB for 9 months, but we're only treating them with doxy, which, as you said, bacteriostatic, not cytal. It just makes no biologic sense.
I know. I'm still waiting for an infectious disease doctor to explain to me why we have no problems giving TB patients 3 heavy-duty antibiotics for 9 to 12 months for an organism that replicates every 15 to 20 hours, but for the organism that replicates every 1 to 16 days, 2 to 3 weeks of doxycycline that doesn't even kill anything. It just, I don't know. I'm a
I
little
know.
dumbfounded on that.
I know, I know. Well, you let me know if you find somebody to explain that to you. I'll be interested to hear. And the other thing, just while we're talking about tick-borne disease, is testing. I remember when we lectured together, we were talking about testing, and I asked you for your pet peeves, and your pet peeve and mine were almost exactly the same. If a test does not have external validation studies, that test may not
Yeah.
be accurate for use. And I think the testing is such a quagmire when we talk about any type of PANS pandas. Can
Yeah.
you comment a little bit on that?
Well, if you look at conventional testing through Quest, LabCorp, the big reference labs, we know the sensitivity of the testing because they do like a Lyme screen first. If that's positive, it flexes over to what we call a Western blot or immunoblot, which is test for more antibodies against the organism. But we know the sensitivity of the Lyme screens anywhere between 43, 46%, which means it literally misses more than half the people that have Lyme disease.
Right.
And we know that if you get tested after 3 months of your tick bite, the likelihood of picking it up goes way down. Immunity wanes with time. So there is a quantitative value to that test. It's measuring how much antibody is present. So depending on where you get tested in time, the further you get away, immunity wanes, the amount of antibody is going to naturally go down, even if the organism's still present, because it's almost like your immune system says, hey, you've been here a while, you must be part of me. And so you don't get this robust immune response. So, that by itself is problematic. It's compounded that there are labs out there now that are using technology that honestly just isn't validated.
Right.
And if you don't validate your technology to know that your positives are truly positives, your negatives are truly negative, you don't know. And unfortunately, a lot of these labs go to a lot of conferences you and I both go to, and they cater to the functional medicine community and make it sound like they're the latest, greatest lab out there. There's one lab in particular, which I won't mention, but I laugh every time I see them at conferences because, one of the things a lab does to ensure quality is they're CAP certified, CAP. That's the College of American Pathologists. And what they do is they send blind samples to labs, known positives, known negatives, or if it's a test that's quantitative, you have to be within a certain range. So it's a good validation thing for you as a lab. It ensures that your techs, your machine, your reagents, everything's working appropriately, and you should get the right result. So this lab says we are CAP certified. Well, they run regular things like blood counts and metabolic panels and lipid profiles. And on that part, I believe they are CAP certified. But then they run all these other tests for Lyme and mycotoxins, which has not been validated. And
Right.
I know they're not CAP certified in that, but they don't tell you that. So
Right.
it's a little misleading. And so certainly as a practitioner, I think, you have to understand the lab you're using, what is the data they're getting, and again, how have they validated that data to ensure that it's accurate.
Yeah.
At the end of the day, even according to the CDC, if you go to their website, Lyme is a clinical diagnosis. It's not a lab diagnosis. The lab testing out there was designed as a surveillance tool for people
Yeah.
who had the bullseye rash and the high fever and all the classic symptoms. So in 40 plus years of understanding Lyme, we've never really changed the testing criteria. We know that some antibodies are very specific to Lyme, some are not. Well, why don't we just focus on the ones that are specific and maybe ignore the ones that aren't as specific because they're not as helpful? But it just hasn't come to fruition. And in our government, they started this tick-borne disease working group,
Ugh.
which I think started in 2016 or 2017, maybe it was earlier. And I know Dr. Richard Horowitz was on that panel, and their whole purpose was to come up with better guidelines for testing, treatment. And to date, as far as I'm aware of, there has been absolutely nothing that has come out of that working group that's been
Right.
helpful for the Lyme community or the
Right.
PANS community.
Right.
Um,
And I think, again, like, so much to unpack, but I think, one, PANS pandas is a clinical diagnosis,
right.
whether we're talking about tick-borne disease or anything, because what also happens is that at least 30%, if not more, especially with tick-borne disease, are immunodeficient or
Yeah.
have immune dysregulation. So if we're looking for antibodies or titers, some of these children and adults can't mount that response that we're looking for. And then I think the other thing, although we're talking about Lyme, when we talk about tick-borne disease, what you're talking about is really just Borrelia. That doesn't even scratch the surface with
Right.
Bartonella, Babesia, that I find in our kids with PANS, that's even more prevalent a cause of the neuropsychiatric issues. Do you find that also?
Absolutely. I know used to call it pandas because we thought strep was the biggest driver. And honestly, yeah, between Borrelia, Bartonella, I find them probably more commonly, certainly in my California patients, than strep as
Yeah,
triggers.
yeah,
And I think we
absolutely.
we can take it, one step further and say, okay, well, you've got this microbial trigger, but again, why? What is it about that organism that's triggering? And again, we find usually there's this whole other plethora of toxins, allergens, things that have kind of gunked up the immune system that we still need to deal with. So again, it's easy to say, well, yeah, just treat the bug. That helps, but I find, to get long-term stability, we have to deal with all these underlying immune dysfunction areas. Whether it's, again, we do a lot of immunotherapy in our practice to desensitize people against the food allergies, the mold, the pollen, the cat, the dust, the dog, the chemical, whatever it is. But again, there's detox pathways that usually don't function very well. So I know you and I both take a much more global approach to this than just targeting the organism. That may be the first step, but we've also got to deal with all these underlying factors that made that thing able to do what it was doing to the immune system.
Yeah. And we're going to get to the low dose immunotherapy because I really want you to talk about that also. But you mentioned mold, and I do want to touch on that because I think it's in the background, if not the forefront, in so many of our kids.
Yeah.
And one of the things that I think you taught me was about looking at mold allergies separate from mycotoxin disease, and looking at some of the antibodies, et cetera. Can you just touch on that? I did talk to Jill. Dr. Krista has been
Yeah.
on this program, but just touch a little bit of that on from your perspective, Darin.
Well, mold can be really, there's two problems with mold. You can have mold allergy. So this is an immune reaction to mold spores that are in the air, and that could be any species of mold, where mycotoxicity is very specific to water damage. There are certain very specific mold species that secrete these chemicals called mycotoxins, which are chemicals that are fat soluble. They like the fatty parts of our body, like the brain. But that's again very specific to being in an area where there's been water intrusion. So whether it's your home or school or whatever. So you could have one or the other or both. But I think what ends up happening in the mold world is people focus so heavily on the mycotoxins, just because, again, they're known to cause all sorts of really bad health issues, that people really skirt over mold allergy. And I
Yeah,
don't think most people appreciate how much mold allergy impacts a child's brain or an adult's brain. I have some people in my practice, when it's a damp, rainy, humid day, they are suicidal. It has
yeah,
that effect on their brain. It can cause cognitive impairment. It can cause mood changes. It can cause sleep issues. So, because there's a lot of overlap in what mycotoxins can do to your brain versus what an immune reaction to mold spores, and of course, if you think about MCAS or mast cell activation syndrome, probably a lot of the mold allergy component is triggering that kind of MCAS situation, where now you've got this broad, again, inflammatory process in the brain as a reaction to the mold spore. Well, mold spores are way more common than mycotoxins.
yeah.
With mycotoxicity, you have to be in that environment that has certain types of mold. Now granted, that's a lot of people out there, and there are a lot of water damaged buildings, but you know where can you go in the world that doesn't have any mold spores? I mean, maybe the
Have you found
poles,
it? Okay.
maybe Antarctica where it's just too cold long enough. Maybe, I don't know, but most of the world has, mold spores. And again, I've seen this consistently. So as important it is to deal with, water intrusion and water damage and mycotoxins, very, very important. But I think it's equally as important to help identify the child that has mold allergy. And again, we'll typically see this in the history. You'll hear about the rainy days, the damp days, the humid
Yeah.
days, thunderstorms, changes of weather, when you start to see their mood, their behavior, their cognition, as a parent, start tracking those days. What was the weather like that day? And when you see that clear pattern, the other thing, especially when I lived in Connecticut, I see it more there than here, is I would hear about kids just absolutely losing it at school. And then they get home and on the weekend, they were relatively fine. I think every school when I lived in Connecticut had a mold issue or
Yeah.
the people's homes. So was it mycotoxicity? Was it mold allergy? But again, this can be a clue that at least mold as a whole may be part of your child's problem. And to do that investigation, get them tested for mycotoxins, but you probably also want to get a testing for mold allergy. Now, the twist to this is that a lot of mold allergy doesn't involve IgE. What does that
Right.
mean? Well, IgE is the immune mechanism that we think of with allergy. So typically pollen allergy, dust allergy, cat and dog, that's IgE. So you get exposed to the dander, the dust, your body makes these IgE antibodies, which bind to mast cells, which then create all the symptoms, the runny nose, the itchy eyes, the sneezing, and so forth. Well, if you look at the package insert for mold RAS testing, which is blood testing, it says that the sensitivity is relatively low, which means a lot of mold allergy is not IgE. And again,
Right.
I've seen this for people who go to the allergist, they do scratch testing or prick testing, or they do the blood test, and they said mold came back completely negative. But again, they'll tell you every time it rains, every time it's damp, I get a headache, I get nauseous, I get whatever. So again, the history I think is equally as important as testing for mold allergy because again, a lot of mold allergy doesn't involve IgE. Now, again, I was trained as an environmental medicine doctor, so there are other ways to test people that don't involve IgE.
Right.
We used to do something called SET or serial endpoint titration, provocation neutralization. In our practice, we do some things that are a bit more esoteric, but there are other ways to try and help figure out if someone's having mold allergy. And again, if you can identify that and start desensitizing them, it makes a huge difference.
Yeah, absolutely. And I know you do that in your practice, and you also do a lot of low dose immunotherapy for the practitioners or parents that are listening or watching. Can you describe that in more detail? Because I've learned so much about that from you and how it might help our kids with PANS and PANDAS.
Yeah, so low dose immunotherapy was actually developed by a colleague and friend of ours, Dr. Ty Vincent, and now
Yeah.
it's been well over 10 years. And I can remember when he first did his first patient was a kid with strep, and I can remember arguing with him about what dose we thought was going to be the right dose. But basically, if your immune system starts looking at these microbes and treating them as allergens and not pathogens, it engages the wrong part of the immune system. And we talk a lot about these T helper cells, T helper 1, T helper 2. T helper 1 cells, by and large, are direct scavengers. They see foreign things, goes after, and gets rid of it. Where Th2 cells, T helper 2 cells, are really the ones that kind of alert the immune system but don't directly get rid of it. They're the ones like, hey guys, there's a problem over here. Somebody needs to deal with it.
Yeah.
So, if you think of it being kind of a seesaw, and of course it's way more complex than that, but for our purposes, as one goes up, it suppresses the other. So, for
Right.
people that have a lot of allergies and certain autoimmune conditions, they're more Th2 dominant. Well, by suppressing Th1, that disposes you to being more susceptible to infection. And those who are Th1 dominant hardly ever get allergies and other types of autoimmune issues because that's suppressing that part. So interestingly, I have a Th1 autoimmune disease and I don't get allergies.
Huh.
Good for me. But the idea behind LDI or low dose immunotherapy is that, much in the way that if you're allergic to dust or ragweed, your allergist or doctor can desensitize you against dust and ragweed using different types of immunotherapy. So Dr. Vincent realized that a lot of the ways that people were responding to particularly strep, it seemed to be it's like an allergen. It's not a pathogen. He goes, well, if we can treat allergies with immunotherapy, why can't we treat the immune system as if it was like an allergy to strep? So
Hmm.
basically, you take strep, you irradiate it, you kill it so it's dead. It can't reproduce, it can't cause infection, but it has all those little bits and proteins we need for the immune system. You dilute it out hundreds, thousands, millions of times, really even into the homeopathic ranges. And now this is where Dr. Vince and I, we kind of parted ways, where originally when this is done, we would mix it with an enzyme called beta glucuronidase. And this is an
Okay.
enzyme that's found in your white blood cells. So it's part of
Right.
you. And Dr. McEwen, who's the ENT surgeon that developed something called LDA, or low dose allergy therapy, back in the 1960s. And LDI is really just a hybrid of LDA. So
Right.
Dr. McEwen was only treating regular allergies, mold, pollen, dust, and animal danders. And so Dr. Vincent had been doing LDA. And again, that's where he got the idea to say, well, if it works for allergens, let's try it for pathogens. So the way it's diluted, the way it's delivered is very similar. But the idea is that, again, by giving this antigen at the right concentration, it starts to build your immune tolerance. And at the end of the day, that's all this really is. It's loss of immune tolerance to that particular thing.
Right.
Why are some people allergic to cats and other people aren't? Who knows? What is it that sensitizes people in the first place? We could have a 20-hour discussion on. But when
Yep.
you get to that point where you're sensitive, really outside of avoidance, we need to do something to build your immune tolerance to not become so over responsive when you have the presence of that allergen or antigen. So, this becomes a huge problem with PANS because a lot of the things our kids are responding to are part of us. So it's
Right.
not necessarily something like Lyme. I mean, if it's strep is part of you. You're never, ever, ever going to not have strep in your body. It is part of your normal flora. So this idea of, again, killing our way out of the problem doesn't work. So what else can we do to modulate the immune system? And this is where LDI can be incredibly helpful. So again, we've got dead strep. We dilute it out. We mix it with the enzyme. We squirt it under the kid's tongue. It tastes like water. It's only about a drop and a half. And then we try and find that right concentration or right dilution that neutralizes their immune system. And what's really cool with this therapy is that once you hit the nail on the head, you will usually see results within 24 to 48 hours.
Yep.
I mean, I have seen kids in full blown PANS, tics, OCD, anxiety. In less than 24 hours, all those symptoms go away. Now, that honeymoon period may be very brief. I've seen it
Right.
last sometimes just a day or two, or sometimes a few days, and then they seem to go back to square one. The parents go, "Oh my gosh, we had this great time where they were so amazing, and now they're back to where they were. It didn't work." No, it absolutely worked. It just didn't last. Well, what ends up happening is we start giving it about every 7 weeks, because that's how long T cells are in your circulation. We're basically, think of it like boot camp. Every 7 weeks, a new recruit comes in, we train him, and we put him out into the forces. We're doing the same thing with T cells, and hopefully we get to enough of a threshold where we've trained enough of your T cells to stop overreacting, that eventually we get to that point where now you just don't need the therapy anymore. So the practicality is, the first time you give it, and once you find the right dilution, maybe it lasts for a few days. The second time it's a week or two. The third time it's a month. So we see a prolonged effect each subsequent time we give the dose,
Got
once we
it.
find the right dose. And again, sometimes it's more than one antigen that's the problem. I never want to hang my hat that's only one thing. And I have a lot of kids where we gave them the Lyme antigen, they got so far, they got 50% improvement. Then I gave them the strep antigen, well, that gave them another 30% improvement. Then I gave them the candida antigen, they got another. I mean, we can see that
Right.
once you've been sensitized to one microbe, it's possible you've been sensitized to others. So, we kind of just have to work through the process of finding what is the right antigen, what is the right dilution. And, in reality, it can take sometimes several months to go through that process, but it can be, again, incredibly powerful when you see this quick change in your kids, and eventually get to that point again where hopefully they don't need the therapy at all.
Right. Okay. So first of all, you're starting with, because many of our kids have more than one trigger.
Yes.
Many of them, it's not just strep, or there are multiple ones. So when you're doing LDI, are you starting with the one that you think is most problematic, most recent, most, best guess? How do you decide which one to start with? And then how soon do you add the other ones when there's more than one trigger when you're doing LDI?
So the one I start with, yeah, is based on clinical history. If we've got labs that show obvious evidence of a high strep titer, high Lyme titer, it just seems likely that this is the probable antigen. Sometimes we do get bamboozled, and I'll just give you a quick example. When I lived in Fairfield, Connecticut, I had a 8-year-old boy come in who had classic pandas. I mean, overnight OCD, anxiety, tics, all that. I did a blood test. His ASO, strep titer was through the roof. And I'm like, hands down, this is pandas. So we started treating him with, started him on herbs. I gave him the strep LDI, and I kind of cycled through a series of dilutions and nothing was really changing. I was kind of surprised. And then the mom says, well, 4 years ago he had Lyme disease, but he was treated. And as far as I know, it was fine. I gave him the Lyme antigen. That night, she called me and said he had a really bad headache. And the next day, all his symptoms were 100% gone.
Yeah.
So
Yeah.
I think what happened is that he had Lyme in the background. It was probably never completely eradicated. When he got exposed to strep, strep was the catalyst. It
Yep.
really wasn't the thing I need to focus on. It was just the thing that set the Lyme off. So,
Right.
but again, it would be very easy because his blood test, was so high. Strep must have been the problem, but it was clearly the catalyst. So we have this idea that some things, like foods or molds or things can be catalysts and may not necessarily be the core problem. But again, this is why often, we're treating different things. So I have no problem using multiple antigens. I tell parents to wait at least a week in between just so you can observe how your child does on each one. And then again,
Right.
once we find the right combination, then we can give them all at the same time. So if he needs a strep 18C and a Lyme 14C and a Candida 10C, once we've got that sorted out individually, well, now I can put them together because I know what to expect.
Yeah.
So it makes it a little bit easier. But initially, if we're doing multiple antigens, I used to be a little bit more, I'll say, cowboyish when we first started doing this, where I was doing a lot of antigens, and I realized it was just kind of a cluster. It was hard for parents to keep track of. It was hard for me to keep track of. So I generally don't do more than 2, 3 absolute max. But I always like to start one if we can to be clear. But sometimes there's two very what seem apparent triggers. If someone's got a mycoplasma IgM that's really high and their ASO is high, I'm like, clinically, I can't tell the difference. Let's do both, but let's just not do them at the same exact time
Right.
so that we're not wasting time trying to figure it out, but we've got enough space that we can be clear how the child's reacting.
Got it. Got it. And you mentioned when you were talking about LDI, homeopathic doses. And certainly there are similarities between homeopathy and LDI. But talk to our listeners, viewers about the difference and the use of both of those.
Yeah, so in homeopathy terms, if you're a purist, we would call this isopathy. It's not really homeopathy. The
Right.
principle of homeopathy is like cures like. In this case, it's like cures same. So the antigens used, like again, homeopathic poison ivy, rust tox, we don't really use for poison ivy. We use it for people who have a skin rash that might look like poison ivy. Where
Hmm.
in the case of LDI, we're actually giving the thing we think is uh, causing the problem. So, there's different ways of using homeopathy. The fact is, when you look at the dilution, if you remember from high school chemistry, this thing called Avogadro's number. You guys remember Avogadro's number? It's, by the way, it's 6 times 10 to the negative 23rd, in case you forgot. So what that means
Thank
is,
you, Darin. I had forgotten.
so it's what, you think about it, it's like as you keep diluting anything out, and if you put a pinch of salt in water and then you keep putting that into a clean glass of water, you take 1 teaspoon out and put it in the next cup. At some point, there's not going to be any salt left in the water. And that's Avogadro's number. At that point, there's no solute, there's nothing left. And so that happens at 12C homeopathically. So anything beyond 24X or 12C is beyond Avogadro's number, which means there's no original substance left. Well, we find we get people Lyme 20C, Lyme 24C, and they react. There's no Lyme in it
Yeah.
anymore. So, we could probably have another longer discussion about, well, why does homeopathy work? Does it work? Is it real? I can tell you, having used homeopathics in my practice for 26 years, it works incredibly well for a lot of people. Can I explain it? I have an understanding of what I think it does. You've got all this stuff in between your cells called water. We call it ground substance. And we know when you look at cell biology that the way cells communicate with each other is through the ground substance. Nerves and hormones and chemicals are relatively slow in
Yeah.
processing, where, you imagine you drop a toaster in a bathtub of water, it's a great conductor of information, and in that case, electricity. So for cells to be able to communicate to each other through the ground substance, that's a very efficient way that all your cells can kind of talk to each other. So we think that, like acupuncture and homeopathy and these things we don't really understand, it's probably doing something at that ground substance level that conveys information to the cell that induces the cell to change. So that's my best explanation. But, sometimes with LDI, we're in the homeopathic range and sometimes we're not. Sometimes we're giving 6C. It's dilute, but there's stuff in it. So there may be a combination of, we'll call it true physiology and some maybe energetic mechanism to how it works. I think the beauty of LDI is that it's pretty safe.
Yep.
The worst thing that can happen with LDI is if you have the right antigen and the wrong dilution, you can make kids worse.
Right.
And any of us who do this have had the experience of giving a dilution to a child, seeing them flare. But the good news with that is that you've now just proven whatever you gave them is what's triggering the symptom. So if there was ever a question about, well, what is it? Well, if I give a child Lyme and Mycoplasma and Candida, and the Mycoplasma and Candida don't do anything, but man, I gave them the Lyme and their OCD went through the roof. Well, I've now just proven Lyme's what's causing the OCD. So now I need to figure out, refigure out my treatment plan, or maybe figure out the right dilution that's going to neutralize the immune system to Lyme instead of being provocative.
Yeah.
So,
And, we often see Herxheimer die-off reactions with lots of our treatments, with herbs, et cetera. But when you see this kind of negative, obviously the next time you give it, you're going to give a lower dilution of the
right,
LDI, correct? But is
absolutely.
there anything that you give to counteract that negative, or is it just time? I mean, for instance, will ibuprofen or skull
Yeah.
cap or other things decrease that negative reaction while you figure out the next best dose to give?
Yeah, I mean, I found Trisalts works incredibly well. We used to have
Ah,
Alka-Seltzer Gold. Alka-Seltzer Gold's not on the market anymore. Claire Labs, now SFI, has one called bicarb fulminate. But when you alkalize the body, it can really help down-regulate that inflammatory response. So I'll have, kids take Trisalts 3, 4 times a day. That will usually help mitigate that die-off. And it gets really bad again. We could use ibuprofen, or I don't think I've ever had to use it, but I know other doctors will use steroids to try and just shut off that reaction. But Trisalts usually does the job. And sometimes, yeah, we just use more anti-inflammatory herbs, more cemento, more Chinese skullcap.
yeah, yeah. Fascinating stuff. And I have had several children that we've shared or that I've shared with the person to whom you sold your practice,
Yeah.
Jaquel Patterson, who I will be speaking with in the coming weeks. And it really is remarkable when you hit on this low dose immunotherapy. You can see that improvement so quickly. And it's fascinating to me and eye-opening for me as well as several of my patients. So thank you for bringing it into my world as a clinician. I wanted to also just touch on just going back for a minute, because I've heard you talk about this. We talk a lot about the treatment of all of these things, but also, the prevention, for instance, with tick-borne disease, with climate change, with deforestation. I heard you talk recently about permethrin, which is toxic when wet, but okay when dry.
Yeah.
Using it, reducing the risk of a tick bite by 70%. Can you talk a
Yeah.
little bit about that too? Because I found that fascinating.
Yeah, no, there was a study done. We figure, especially with tick bites, most tick bites come through the feet. The tick crawls up
Yeah.
your shoe, your foot. If you're walking barefoot, obviously that's the lowest point, right? It's possible, of course, to get a tick bite if you're walking through a forest and a branch hits your head or your shoulder, but it's mostly through your feet. So yeah, they found that if you spray your shoes and socks with permethrin, which again is very toxic when wet, but once it dries, it's actually very safe to touch. It reduces the risk of a tick bite by over 70%. And I think, again, if you live in a tick endemic area, that's good information to know. I think that can be one of the best things you can do to protect you and your children. So I tell my patients, it's like when it's a nice day, have a dedicated pair of your outdoor shoes and socks and go out there and wear a mask and gloves and protect yourself, whoever's the sprayer, and you just spray it, let it dry overnight. And then afterwards, once it's dry, you can touch it and all that. The one thing I don't know, and I've been trying to find, it's like with socks, particularly because you're going to wash your socks, you're not generally washing your shoes. At some point, it's going to wash the permethrin out. So I
Right.
don't know how often you might need to apply it. And obviously, it's going to be a function of how often you wear the socks and wash the socks. Because I know they sell clothes you can buy online that are already permethrin coated.
Right.
I went to Belize years ago and bought a pants and shirt that already had it infused in it because I'm a mosquito magnet. But again, it can be incredibly helpful, and it's a very, I think, cost-effective way to reduce your risk, certainly of a tick bite.
Absolutely. Absolutely. I just find that fascinating because I think, we want our kids to be outside. We
Yeah,
do not want them to be indoors because of the fear of tick bites or any type of exposure. And I think having ways that we can decrease the risk. And that was really that study was fascinating to me because it was such a big decrease of 70%.
yeah.
That was amazing.
Yeah, and
Um,
and people can use tick tubes around the house as a way to
yeah,
trap tubes. When I lived in Connecticut, I used to spray my property with garlic oil, which is a great, safe, natural anti-tick thing. I find most of the big chemical companies that say, we'll spray your yard for ticks are usually using something either very toxic or even what they
right,
say is natural. A lot of them are pyrethroids, which really aren't that natural. But
right.
yeah, garlic oil actually works pretty well.
Great. And also just, like you said, it's a lot around the ankles, but also I see a lot of kids where they're getting it behind their ears, in their scalp,
Yeah,
et cetera. So something like that on a handkerchief,
yeah,
around their neck. And also one that really worked because I still live in Connecticut is 3 feet of uh wood chips around the property
yeah,
because we're not just talking about deer, we're talking about field mice, et
yeah.
cetera, that are coming into the yards. And I think that was another one that really helped in prevention. And one last thing, Darin, we've talked about herbs, botanicals, LDI, but often in our kids, whether it be whatever the reason for PANS pandas, their nutrients are depleted. And using things like magnesium, zinc are essential to what we do. Can you speak to that a little bit too?
Yeah, I mean, we know that our food supply is just devoid of a lot of nutrients. With our farming practices, we don't really practice regenerative farming, so the soil gets depleted. And of course, the more they use pesticides and herbicides in particular, those deplete the soil of a lot, especially these trace nutrients, things like
Right.
selenium and zinc,
Yeah.
silica and boron and so forth. So, even if you've got a child who's a good eater and you're eating organic, fresh food, locally grown, I mean, it helps a lot. We know that organic produce as a whole has a higher nutrient content because of the less pesticide use, but it's not perfect. So we're kind of in a situation now where most people, not just children, need these excessive nutrients because we're just not getting it through our food supply. And I'm hopeful we'll see changes in our farming practices in the years to come so that we get more nutrient dense, nutrient rich soil so that we don't have to depend on it. But we find so many of our kids need these, particularly the trace minerals, just because they're not in food. But if you look chemically at what they do in the body, I mean, my gosh, magnesium and B6 are cofactors in almost every metabolic pathway, mitochondrial function, selenium for connective tissue and our immune system, all
Thyroid.
thyroid. Yeah, exactly. So, they're so important for normal functioning that, as much as difficult as it can be to get some of these kids to take stuff, it's unfortunately kind of where we're at. We
Yeah.
need to.
Any tricks you found in getting kids to take stuff?
Well, hide it as much as possible. Try and make it fun for kids as much as you can make it a game. Depends on the age of the child as well. A lot of our kids are so taste, texture oriented. Anything that looks, smells, or they perceive. I'm always amazed at like zinc drink. I used to use a ton of zinc drink, which I taste nothing. It tastes like
I
water.
know.
And you put it in, juice, and the kids are like, no, there's something in it, and they won't take it. So it can be challenging. So for kids who are really taste averse, as much as we can get in through skin, sometimes transdermal application works better, sometimes IV if you can get a kid to sit for an IV. But as much as we can try and get it through food so they don't have to take supplements is always preferable. But I have kids like who are picky eaters and we can't get greens in them. But you know what? If you mash up a bunch of greens and you put it in a meatball, they'll eat the
Yep.
meatball. And so
Yep.
as much as we can be creative in the kitchen to find ways to hide things. So, for supplements, I mean, liquids and powders as a whole, there's usually creative ways that we can find to get in. I have some parents who just kind of do a little shot and then they get a
Yeah.
syringe and they just kind of squirt it and then give them a juice chaser afterwards. Every child's so different. You just kind of have to find what works best for them.
Yeah. And don't forget about good old bribery. Best
And
form
good
of
old
parenting.
bribery. Yeah, I have a
Yeah.
lot of kids who get a lot of toys, but
Yep.
at the end of
Yep.
the
Or
day,
time with mom and dad, or that's when they get that extra treat after they down that shot glass.
yeah,
They get that dark chocolate or, something even a little bit better. But anyway.
yeah.
Any other treatments, assessments, anything else with regard to PANS, PANDAS, tick-borne disease that you want to leave everybody with that we haven't talked about?
Well, I just want to give an extra plug for, not just LDI, but I mean, there are other types of immunotherapy. We also do a lot of, I said, low dose allergy therapy, sublingual immunotherapy, again, to help take that pressure off the immune system for all these other distractions, whether it's food, pollen, dust, animals, chemicals. I have a lot of kids that are reactive to their own hormones and neurotransmitters, and we desensitize against that. To maybe find an environmental medicine doctor who can do that evaluation for your child and really figure out all these different things that are becoming immune distractions
Yeah,
because they're all treatable.
absolutely. And you're an amazing clinician, author, everything that I could say about you. But if somebody wants to find you, Darin, how would they find you?
Best place is just my website. It's just Darin Ingels, N as in Nancy, D.com.
Okay. All right. Darin Ingels, and it's DarinIngelsN as in Nancy, D as in doctor.com. And Darin, you are always a wealth of information. You are such a great clinician. And I so appreciate being able to talk to you, lecture with you, and just know you as a person. So thank you.
Great. Thank you, Nancy.
That's it for today's episode of Demystifying PANS, PANDAS. I hope you're walking away with insights, tools, and hope to help you and your child on this journey. If you found today's conversation valuable, be sure to subscribe so you never miss an episode. Share this podcast with anyone who might need it. It could be the lifeline they're searching for. And if you have a moment, leaving a review helps us reach even more families who deserve answers. Also, for more information, training, and community, check out our website, drohara.com, and join our annual membership. And remember, every step forward, no matter how small, brings us closer to healing and understanding. Until next time, be present, be hopeful, and we look forward to seeing you next time on Demystifying PANS, PANDAS.